So, you're expecting a baby. If so, you are likely feeling this massive, wild mix of anticipation and, let's be totally honest, a pretty healthy dose of anxiety right now. The biggest question on absolutely every expecting parent's mind as they get closer and closer to that due date is simply, what actually happens when labor begins? First off, let's just take a giant collective deep breath because it is completely normal to feel overwhelmed when you're preparing for your first baby. The unknown is always scary, right? But childbirth is a journey, and like any journey, we can prepare for it step by step so that you feel confident and empowered rather than panicked. Welcome to this explainer. Today, we're taking those dense, comprehensive childbirth preparation class notes and turning them into a clear, highly visual roadmap. My absolute goal here is to demystify the entire childbirth journey for you. We're going to translate clinical notes into real-world expectations so you know exactly what to anticipate. So how exactly do we navigate the journey from those final heavy weeks of late pregnancy all the way through to the postnatal ward? Okay, let's dive right into our 6-step roadmap. We'll be looking at late pregnancy discomforts, identifying crucial warning signs, spotting the early signs of labor, understanding the 3 stages of labor, exploring pain relief options, and finally looking at exactly what happens after delivery. Part 1. Navigating late pregnancy discomforts. We are starting in the final stretch, and let's be real, your body is taking a serious physical toll right now thanks to immense hormonal changes and a rapidly growing baby. Your bump and your bladder are literally competing for space. Things like backache happen because your hormones are actively relaxing and stretching your ligaments to prep your body for birth. The medically advised solutions here are highly practical. Maintain good posture, wear low heels, and give pregnancy yoga a try. And for that intense heartburn caused by hormones and the baby pressing right up against your stomach, try eating smaller meals more often. Definitely avoid spicy and fatty foods, and try sleeping in a more upright position. Now, here's the deeply relatable irony, right? Everyone tells you to build up your sleep reserves before the baby comes, just as pregnancy insomnia hits you. To help with that insomnia, avoid afternoon caffeine and really try to limit your screen time before bed. You might also be dealing with constipation, so increase your fiber and water and maybe consider switching to liquid iron, since some solid supplements can kind of consolidate things. For swelling, raise those feet up and wear support tights. And regarding frequent urination, please absolutely do not decrease your fluid intake just to avoid the bathroom. You absolutely need that hydration to prevent infections. All right, part 2, crucial pregnancy warning signs. Now, as we shift from normal everyday discomforts to critical red flags, we have to talk about weeks 16 to 24. What's really interesting about this numerical window is that it's the crucial time when you should first start feeling your baby move. Getting to know your baby's unique, day-to-day movement pattern from this point on is absolutely vital for monitoring their health. A lot of people actually don't realize that your specific placenta placement totally changes how this feels. With a normal placenta position, kicks are easily felt right against the uterus, but with an anterior placenta, meaning the placenta is sitting at the front of the womb, it acts like a cushion, and that can make kicks much harder to feel. However, we must strongly clarify this. You should still feel regular movement regardless of where your placenta is placed. Listen, there is a critical rule here, and you've got to take this incredibly seriously. Do not wait until the next day to seek advice if you are at all worried about your baby's movements. Maternity units are staffed 24 hours a day, 7 days a week. If those movements slow down, change significantly, or stop altogether, you contact them right away. No exceptions. Let's quickly run through a few other major medical red flags. Vaginal bleeding could indicate preterm labor or placental issues. If your waters break or rupture, pay close attention to the color. Clear or pink fluid is perfectly normal, but green or brown means the baby had a bowel movement and needs immediate checking. Severe itching might be a liver condition called cholestasis. Pre-eclampsia presents with severe headaches, vision problems, and sudden intense swelling. And deep vein thrombosis usually shows up as pain or warm skin in just one calf. So the crucial point is seek immediate medical help from a hospital or your hebamme, your midwife, if any of these occur. Moving on to part 3, early signs of labor. Let's bring the energy back up because baby is almost here. We're transitioning to the exciting and honestly kind of strange early signals that your baby is finally on the way. These symptoms are really just your body clearing itself out and prepping for the main event. You might experience mood changes and irritability that feel a whole lot like PMS. Then there's that bizarre nesting instinct, literally a sudden, aggressive urge to clean your house top to bottom just days before birth. Your digestion also slows down, which can unfortunately lead to diarrhea and vomiting. You might feel period-like pain a few days prior, and of course, the classic sign, your water's breaking.
Part 4. The 3 stages of labor.
When you actually get to the delivery room, it's reassuring to know that labor is a highly structured, predictable biological process. The body brilliantly compartmentalizes the birthing process chronologically. Stage 1, your cervix shortens and dilates with regular contractions. Stage 2, the cervix is fully dilated and the pushing phase begins. And Stage 3, the delivery of the placenta and membranes. 10 centimeters. That is the magic number for full dilation. The first 5 centimeters are widely known as the tough 5, and they can take a long while, but it's really encouraging to know that afterward, there is a light at the end of the tunnel. From there on out, dilation typically progresses at a much steadier rate of about 1 centimeter per hour.
Which brings us to Part 5, pain relief during childbirth.
That second stage of pushing can take anywhere from 30 minutes to 2 hours for first-time mothers, which leads us perfectly into discussing your menu of pain management options, each with their own pros and cons. Paracetamol or Buscopan are great for early, mild pain. Gas and air, or Entonox, is an inhaled mixture of oxygen and nitrous oxide that really helps you focus on your breathing during those contractions. Maptid is a fast-acting opioid that takes the edge off but can definitely make you feel drowsy. And an epidural is a local anesthesia that blocks pain impulses, providing almost complete pain relief. Now, we need to demystify a medical term you might hear, episiotomy. It's a surgical incision made in the perineum to speed up delivery if the baby is in distress. But to proactively help reduce the risk of natural tearing or needing this procedure, highly recommended preventative measures include perineal massage starting from 34 weeks, along with regular pelvic floor exercises. And finally, Part 6, what happens after delivery? Okay, take a long exhale. We've made it through the birth, and now we enter the gentle aftermath of the childbirth journey. Your recovery involves managing physical discomfort, a bruised perineum, and postpartum bleeding. Please do not be shy to ask your medical team for pain relief like ibuprofen or Voltarol. Also, know that heavy bleeding is entirely normal and can last up to 6 weeks for a vaginal delivery. The emotional and physical reality of postpartum recovery follows a pretty distinct timeline. On delivery day, expect sheer physical exhaustion, pain, and bleeding. Now, day 4 is notoriously difficult. This is when your milk comes in, you might run a slight fever, the postnatal blues hit, and you can feel highly tearful. By 6 weeks, physical recovery is continuing, but we must actively monitor for postnatal depression. This is a genuine risk that affects 20% of new mothers. Please reach out for professional help and support if you find yourself struggling. There is zero shame in it. So I want to leave you with this final, provocative thought. How will you prepare your own postpartum support system? Because ultimately, giving birth isn't about perfectly predicting exactly how the event will go. It's about having the right toolkit, the right knowledge, and the right support system to navigate